We know from many years of experience that it's possible to care for patients with Ebola safely without risk to healthcare workers, but we also know that it's hard, that even a single breach can result in contamination. And one of the areas that we look at closely are things like how you take off the gear that might be infected or contaminated.
The sight of individuals wrapped in hazmat suits is about to become more than a little commonplace here in America. Ebola is not only here, but it has now started to spread. And we are told everything is being done to ensure it stops in its tracks. Promises the American people are starting to find hard or perhaps even impossible to believe. Welcome to MidPoint. Assistant Professor in the Department of Public Health Sciences at Penn State Hershey. Adjunct Professor of Emergency Medicine at George Washington University of the Health Sciences. And one who has made trips to Africa and seen the Ebola crisis firsthand, Dr. Gavin Macgregor-Skinner joins us today. Doctor, thank you so much for being here.
Thank you very much.
Doctor, when you hear CDC head Thomas Frieden saying that there was a breach in protocol, doesn't that tell us that this is human error and someone did not do something that they were instructed to do, told to do, and should have been ready to do in case this happened at their hospital?
No, you're correct. And it's not just human error, it's a systems failure. And you have to now ask the question, where was the management? Where was the supervision of all the hospital staff that had direct contact with this Ebola patient?
Then let's put the blame, and again, I know that you disagree in blaming the nurses, but is that not where the fault really lies? Because medical professionals, even if they're not told by someone in control, certainly they're aware of what's happening, and certainly they should be aware of what this is all about. So why didn't they take these precautions?
No, it's reflected in the training that when we teach hospital staff how to handle the Ebola virus. Even if you go back to the CDC guidelines, you'll see that in their hospital preparedness checklist, they talk about patient care and putting on and taking off the personal protective equipment. You use the buddy system. What that means is I'm putting on the equipment, I then have a colleague who is watching me to make mistakes. When I take it off, that colleague is also watching me to see if I made mistakes. When I'm in with the patient, someone is watching me and supervising me with a checklist all the time to see if I make mistakes. If I make a mistake, we take corrective action there and then on the spot. And I don't know whether this was happening at the Dallas hospital.
Is this arrogance then on the part of people who feel, oh, don't worry about it. Look, I know that there's guidelines here, but look, I know what I'm doing here. I can do it by myself and I can get by. Isn't this very much an arrogance case?
No, this is very much about the guidelines are just that. They're a piece of paper that you can download from the internet. Where we haven't helped hospital staff throughout all of the US healthcare system is how to implement those guidelines. And that's through training and practice and drills. We haven't set up a system to do that. We haven't created the how-to videos that we could set as a gold standard so that everyone in the US healthcare system and the US public could see how to mitigate and decrease the risk of handling an Ebola patient, Ebola waste, or just the Ebola virus. We haven't even done that. We haven't used all the tools in the toolbox.
So as far as you know, here in the 21st century, where just about everything is on video, one way, shape, form, or another, the CDC, with all the money they have, has apparently then failed in their training, and they still don't have something as simple as a video presentation that doctors and nurses can watch?
If you go and search, and we all use Google, go and search CDC Ebola, you'll come up to the CDC Ebola site. Click on for healthcare workers, and there's a site there. All the documents are PDF paper-based documents. There's not one video on that site.
Then whose fault is this? Is this a systemic fault? Is this one administration's fault? Does this go to one person? Where do we start? Because sooner or later, if Ebola continues to spread, we have got to put the blame somewhere.
We need to understand who is managing the event. Who is there not just to write the guidelines, but who is actually out there managing the event to help hospitals be prepared and to provide that assistance. And at the moment, it's all laid on the CDC. Is this just a lack of imagination where we haven't created proper tools and instruments and taken the examples we have in our universities of how to train and train adults? I think this is. And so now we have to go back and say, who should be managing this event with a highly infectious disease like Ebola?
I got about 30 seconds left. We'll take a break, come back. But Senator John McCain said over the weekend he believes the president should name an Ebola czar. Do you agree with that?
We need someone to be the coordinator. And at the moment, whether it's another government agency or an independent body or just one person, we need someone to be at the table managing all the resources we have to ensure that we decrease the risk as low as possible and we make a safe working environment for our hospital staff and make safe communities.
All right, I want you to think on this question as we take a break, if you would trust the government to make that decision. Hang tight, we'll come right back, because when we return, the infectious nature of Ebola and what we might still be missing in stopping the spread. Think airplane. And later on this hour, a stark reality America may have to face when it comes to the nightmare that is Syria. It's on MidPoint.